Type 2 diabetes is on the rise, especially among young people, and that will have a dramatic impact on the long-term costs of the healthcare system. But there are ways to stop the rise and stay healthy. Tonight, we'll explain how. At the table, doctors Danielle Martin, family physician with Women's College Hospital, Samir Sinha, a geriatrician at Mount Sinai, Jay Udell, a cardiologist at the Peter Munk Cardiac Center, and Lorraine Lipscomb, the director of the diabetes program at Women's College Hospital. Their thoughts in a moment, but first, some hard facts. For starters, I know what you're thinking. What's the difference between type 1 and type 2 diabetes? Well, basically it's this. Type 1 is having a total lack of insulin and living with that issue for a lifetime. Type 2 is not having enough insulin or having ineffective insulin, but still having the chance to do something about it. What's the impact? Insulin issues create control issues for sugar in your blood. That can lead to kidney disease, heart attacks, strokes, and a dozen other problems. Overall, diabetes is a huge strain on the healthcare system. 1 in 4 Canadians live with it. By 2020, that figure will be 1 in 3. This year, it will cost the healthcare system $14 billion. Up to 95% of diabetes cases are type 2. It's estimated that more than 50% of those could be prevented. If one parent has it and nothing is done, the odds of a child getting it are 15%. If both parents have it, the chances rise to 75%. So, how do you prevent it? And how can you stay healthy even if you do get it? Time for some answers. All right, remember, type 2 is our focus tonight. Why is it so dramatically on the rise?
Well, in part, it's because our population is aging. In part, it's because of the makeup of immigration to Canada. But a lot of it also has to do with the lifestyles that we live here as Canadians, and that's something that I think we're going to discuss a lot tonight.
Like what lifestyles? What we eat?
What we eat, how heavy we are, how active we are. All of those things have a significant impact on the risk of developing type 2 diabetes over a lifetime.
Samir, do you want to add to that?
I think the challenge with diabetes too is that sometimes we don't see the initial effects of perhaps the balance of lifestyle factors and how we eat. We don't see the consequences immediately, and diabetes is one of those things where it takes years, decades, where we actually see the consequences add up, and that's one of the challenges in preventing the development of it and decreasing the spread.
Danielle said the elderly and young people. Those are the two groups most at risk. Jay?
Those are the two groups that are most at risk, unless you also come from a family predisposition. So that might trump your age. You might be getting diabetes at an earlier age, and also different racial or ethnic backgrounds. So if you come from African or Caribbean, Aboriginal, Hispanic, as well as South Asian and Asian, those backgrounds have a predisposition to developing the disease earlier.
Now, you are focused very much on diabetes, Lorraine.
Yes.
And when we talk about children, you see some of those numbers, the dramatic rise happening a lot with children. Why is that? Food? Activity?
Well, I think it's a combination of factors. As we all know, and as Danielle has mentioned, we've seen a large increase in a large change in the lifestyle that we're living, and that's affecting our children as well. So children are far less active than they used to be. They're eating more highly caloric foods than they used to. And as a result, we're seeing higher rates of obesity in children. In fact, there are estimates that if a person is obese by the age of 18, their risk of getting diabetes is up to 70% in their lifetime.
Wow. The epidemic word is being thrown around a fair amount, and I want to see whether we have consensus at the table. Is this an epidemic?
Well, I think, we don't want to use words that kind of scare the public, but I think this is a growing issue, that rates of diabetes have doubled in the last 10 years, for example. And they say that, as you said, 1 in 3 Canadians, may actually, or, will actually have diabetes if we don't actually get our acts together.
In 5 years.
It's a big issue. So the key is that there are things we can do to prevent it. And I think that's one thing we've focused in our healthcare practices, making sure people understand it so that they can prevent it. And if they're living with it, hopefully deal with it better.
I'm not an expert, but when you see those kind of numbers, you say, this sounds like an epidemic to me.
Well, sure, the rates are rising, and we can use words like epidemic, but to me, what's epidemic are the underlying causes, and that's what I think we really need to be talking about here. And we've talked a lot about lifestyle, and lifestyle is very important, but poverty, actually, and the upstream determinants of health really are very powerful in terms of what dictates people's risk of developing the things that lead to diabetes. And so I think when we talk about really what's epidemic, we need to look at the social factors that are epidemic as well and try to deal with those.
All right, well, let's try to break it down on a number of levels. And Jay, you started. In terms of preventative means, what is the best way to deal with this? When those numbers we saw suggest 50% could be, the diabetes 2 factor could be eliminated for them if the right preventative measures are taken. So what are the right preventative measures?
So there were clinical studies that have shown that if you are put into a better health diet, low calories, high fiber, low saturated fat, and have more activity. So they say, and this is why we have the recommendation of 30 minutes of activity 5 days a week, or about 150 minutes of activity where you actually break a sweat. It's not just leisurely walking, you actually have to break a sweat. That can reduce the risk by up to 50% in those who are predisposed to having diabetes, those who are overweight or have those risk factors.
Lorraine, what do you target when you're talking about preventative?
So, I think most people are aware of what they need to do to lower the risk of diabetes. Most people are aware of that they need to increase their physical activity, they need to eat less. The problem that I find, both in my clinical practice and I think the research is showing, is that people have a difficult time making those changes due to all the barriers that they have. For example, busy lives, lack of sleep, competing demands, and societal barriers to being able to make healthy choices. So I think we need to target some of the way in which choices are presented to people so that they're able to make healthier choices.
I still don't quite understand why it's suddenly become such an issue. I mean, I can remember when I was a kid, you were worried about not getting enough activity, you were worried about what you were eating. I mean, all those issues were at play then. It's that much worse today than it was 20, 30, 40 years ago?
It is, because I think one of my professors in medical school used to always call this chronic sedentary feasting, and this is really the epidemic. The idea that the food choices we have available for us are largely, high calorie, loaded with sugar, loaded with fats. There's less incentives for us to move around now. If you're watching TV, if you're playing your games, or you're on Twitter or doing whatever, you're less likely to be active now. And so just the rates of physical activity have decreased, in our society. We've made it less convenient for people to stay active. We've also made it less convenient and able, with poverty and other issues, for people to be able to afford and choose and want to choose healthier foods. So these are the societal factors that have all come together that, combined with genetics and everything else, have made diabetes such a problem that it is today.
Danielle, get us back on the preventative track here.
So, I mean, if you think about, for example, the issue of healthy food choices, when I first started practice, I spent some time working on northern remote reserves in Ontario, where the rates of diabetes are extremely high among Aboriginal populations. And in the middle of winter, the notion of getting something healthy to eat was essentially absurd. I mean, you ate what there was available to you, and it was cheaper to buy Coca-Cola than it was to buy milk at the only store on reserve. And so, I think when we're that's an extreme case. But if you look at the food deserts in our cities, the places where people can't walk to a store to purchase something healthy to eat, the way in which our transit is set up, that's putting people into cars for hours and hours a day to get to and from, or on buses to get to and from where they need to go. All of those factors add up to a perfect storm when it comes to things like diabetes.
Is it all, the onus all on individuals here in terms of trying to deal with this?
Absolutely not. I think in an effort to increase efficiency, convenience, and comfort as a society, we've engineered a society that promotes unhealthy choices. And so I think it really has become a public health concern and a societal concern. And as I mentioned, there are major barriers for the individual to make changes, and they're up against a lot of these factors that we're discussing that we really need to tackle as a society.
Well, how do you tackle it? I mean, what is it? Is it like a massive ad campaign? Is it doctors addressing this issue with patients, even if it's not obvious as an immediate concern?
I think it's all of the above. I think doctors and the healthcare system can play a role at raising awareness, counseling patients, providing them with support to help them make those changes. But I also think that the whole landscape of how we present choices to people need to change. For example, we need to make the healthier choice the easier one. We need to make walking and biking easier to choose than taking your car. Outdoor activities for kids more enjoyable and safe than the screens, and nutritious foods actually cheaper and more accessible, as Danielle pointed out, than the unhealthy foods. And unfortunately, right now, the balance is off.
What about the elderly? I mean, we talked about kids and especially trying to get at them on with some of these issues. How much of a problem is it with the elderly?
This is obviously Samir's expertise, but it's a problem. As we have an aging population, the incidence and prevalence of type 2 diabetes is going to rise. And again, they have special barriers per se that it's harder to get activity into the elderly, and they also have different reactions to medications. And Samir, you can speak more to this, I'm sure.
I think there's a few considerations. I think the challenge is that if you're an older person and you're living with diabetes, you may have been living it for 20 years or longer. And so some of the consequences, when you have decreased sensation in your hands or feet, that might affect your balance, which could increase your risk of falls. It may mean you can't do basic tasks as you could do more easily. And if your vision is affected, you may not be able to drive. So this is where the consequences of diabetes catches up. The other aspect is that we're realizing now through research that Lorraine and others are involved in is that we don't have to be as strict with our targets in terms of how we treat diabetes, for example. But we also have to be mindful that as we get older, there's an increased risk that we have memory problems. And then if that memory problem interferes with you taking your medications or recognizing some of the complications of medications, we have to be more mindful when we're treating people with diabetes to think about those factors related to age.
You know, we touched obviously mainly on diet and exercise and activity, but we've mentioned genetics a number of times here. What is the role that genetics plays in diabetes 2?
So it plays, actually genetics plays a role, and family environment even beyond genetics plays a role. So I mean, certainly we know that there are particular populations that are genetically predisposed, and in my own practice I see a lot of South Asian people who are heavily predisposed to the development of diabetes, as well as high blood pressure and high cholesterol, other things that predispose them to heart disease. But there's also a role around the sort of what I think of as the quasi-genetics of people growing up in a family where you eat a certain way and you live a certain way, and that gets passed down too, although perhaps not through the DNA. It gets passed down in terms of whether you learn to cook and what your relationship to food and activity is, and whether you go out together as a family on the weekends. And so family history plays a role in a number of different ways.
All right, we got to take a quick break here, but when we come back, we'll have this question. What's the most important thing that has to happen to curb the rise of diabetes in Canada? And welcome back to our national checkup. Type 2 diabetes is the issue tonight with doctors Danielle Martin, Samir Sinha, Jay Udell, and Lorraine Lipscomb. Who should be screened and tested, and how often?
So it is recommended that all adults over the age of 40 should be screened every 3 years for diabetes, and they perhaps should be screened earlier or more often if they have risk factors for diabetes. And in order to determine whether somebody is at significant risk of diabetes, there's actually a great online screening, an online risk calculator called the CAN risk that can be found, and people can actually calculate their risk and likelihood of getting of whether or not they already have diabetes.
All right, we'll add that. There it is right now, the website to get that risk calculator, and you can do it yourself. Quickly around the table now here, what's the most important thing that should be done to try and curb the growth, the rise in diabetes? Jay?
I think as a society we should think about tackling the high caloric fast food and processed food industries. I'm not going to make a lot of fans out there probably with that comment, but I think if we had healthier choices, that would be a major first step. When you asked why this stuff was around, why is this around the 60s, 70s, and 80s, I don't remember there being a fast food for Starbucks and McDonald's, and sorry I'm naming names, but they weren't around so conveniently back
Actually,
then.
some of them were.
Right.
The only one at the table here who was growing up in the 60s. Samir.
We need to enable healthier choices, such as activity. And so I recommend everyone take the stairs. Climbing just 20 flights of stairs a week can significantly reduce your risk of death, but also diabetes. Walking, biking, we need to enable more healthy activity.
20 flights of stairs.
Just 20 flights of stairs a week.
That's not many. It's only a couple a day, right?
Yeah, so I think we actually, if we focused on making our cities more livable, that would make a big difference. If you look at the populations where diabetes is concentrated in our urban communities, they don't tend to be in very walkable environments. And so I think actually, ironically, this is one of those health issues where if you come at it sideways, instead of focusing on the drugs aspect and the treatment aspect, if you look at prevention and the way that we kind of build our lived environments, we could actually do a lot to reduce the rates of diabetes in Canada.
Lorraine, you get the last word.
So the older we get, the harder it is for us to change our habits. And so if we're going to really tackle this problem, we actually need to target people when they're young. And I would suggest that we actually target families, young families, in places where they frequent. So for example, in the school system, so elementary children and their families, can we provide them with support and opportunities for increased physical activity, for resources for healthier eating, for how to prepare meals at home. And so that way we can actually help families when they're just starting out and when they're building their lives.
And initiatives like that in New York City have been shown to curb the rate of diabetes, obesity at least in the childhood, in the kids in the school system, right?
Right, absolutely.
Good advice. Lots to follow there. Thank you all.